Method is the mode or rule of accomplishing an end. There are two methods of repertorization. Aggregation method, elimination method. 1. Aggregation method, scientific method. In this, all the analyzed symptoms are written one after another and the indicated remedies are written against them depending on the process selected. The frequency of the appearance and the sum of marks scored by the medicines are calculated. This is the repertory value. ADVTG. No symptom, however insignificant, not neglected. Final outcome is the faithful reflection of the symptom expression in the drug pathogenesis. Demerits. Laborious and time-consuming. Both the prominently expressed symptom and vague symptoms are awarded the same status. Point 2. Elimination method, artistic method. Dr. Margaret Tyler introduced this method. In this method, the symptoms are arranged in a hierarchy in accordance to the schools of philosophy of the selected repertory. Eliminating symptoms are those symptoms which throw of all the medicines that are not needed for the patient and bring only those medicines which are required for the patient. The eliminating symptom is very important in the exercise of repertorization because it dictate and determine the medicines that compete for the mantle of the simillimum. It acts as safe shortcut to the prescription in the hands of the experienced physician. The elimination mode can be single-step elimination. Cascading elimination, single-step elimination. The elimination of the medicine is done only once, at the beginning of the exercise. The most prominently characteristic symptom is selected as the eliminating symptom. The medicines indicated for this are noted down. For the next rubric, symptom, only these medicines which are common to the eliminating symptom are considered. Medicines outside the eliminating symptom underscore whatever be its grade underscore is not considered for repertorization. Cascading elimination. In this method, elimination is carried out through the whole process. Each symptom became the eliminating symptom for the next symptom. Extreme caution and care should be taken in structuring the hierarchy of symptoms. The symptoms have to be arranged in the descending order of importance. The medicines in the first symptom rubrics are noted down. For the second symptom, only the medicines covers the first symptom are considered. On working out the third symptom, only the medicines those are indicated against the second symptom are selected. So first symptom is the eliminating to second symptom. Second symptom is eliminating for third symptom and so on. Thus each symptom is the eliminating symptom for the next symptom. The repertory value of each medicines is worked out in exactly the same manner as in aggregation method. ADVTG. Labor and time consumption greatly reduced. Dis-ADVTG. If one is not thorough and effective while structuring the hierarchy of symptoms, he may fail. Methods by various authors. 1. Kenshin method. Useful in cases in which generals and particular symptoms stands out with their modalities. This method of grouping from generals to particulars with important to mental generals is called Kantian method of repertorization, which is the best and commonly used method. 2. Hahnemann and Boenninghausen method. When there is no mental symptoms but only particulars with associated concomitants, complete symptom. We can use TPB as our aid. This method is called Hahnemannian or Boenninghausen method. 3. Working on physical generals. Cases with ill-defined mental symptoms are concomitants, but only physical generals. We may use any general repertory such as Kent, starts with physical generals, next mental symptoms then particulars. 4. Working on peculiarity. Cases having one or more peculiar symptoms with few generals and undefined symptoms. Our aim is to find out the medicine which have that peculiar symptom and then proceed with vague or common symptoms. Any repertory which deal with the peculiarities can be used for this purposes. This method of finding a medicine with the help of a peculiar symptom is called keynote symptom method. 5. Working on pathological generals. When we come across patients with a few common symptoms or pathological symptoms only. The following details will help in the selection of medicines. Patient's personal history and family history. Temperament, complexion, color and texture of skin. Particular organ or tissue affected. Location, character and physical aspects of lesion. Possible cause of illness. When all the available symptoms are put together, they may direct to the medicines. 6. Working on technical nosology. Prescribing on nosological diagnostic terms or lab investigations. When nothing to prescribe upon and the patient's presenting with diagnostic terms without any symptoms, e.g. aneurysm, atheroma, etc., we can use any of the clinical repertories such as Borger's clinical repertory. These would not help in the choice of medicine but will bring us close to a set of medicines. Techniques of repertorization. Thumb finger method, bookmark. Plain paper method, repertory chart, sheets, cards, computers. Thumb finger, bookmark technique. This method is meant for quick reference in a busy practice, for those who have more experience with the repertory. Usably 2 or 3 characteristic symptoms are taken. Bookmarks or thumb and fingers are placed at the pages where the selected rubrics are present. These rubrics are scanned visually, and the frequently occurring medicines which have higher grades are short-listed for selecting the simillimum. ADVTG. Useful when the symptoms are less in number. Useful when the rubrics indicate less number of medicines. No necessity of writing symptoms or medicines but only mental work. Time taken is very less, useful for busy practitioners. ADVTG. Visual errors can lead to failures. Little use when number of symptoms are more. Plain paper method. The symptoms are written down on a plain paper, and the indicated remedies are written against them on the basis of the method and process selected. The simillimum is selected on the basis of repertory value. This technique is very time-consuming for the aggregation method, as each symptoms and its medicines have to be written down. But the elimination method can be conveniently and easily worked with the plain paper technique. The medicines are written one below the other and the grades are marked against them. The first column of the grades represent the value of those medicines in the eliminating symptom. Subsequently, the grades of the medicines of the other symptoms are marked. If a medicine found under the eliminating symptom is not indicated for any of the subsequent symptoms, a 0 mark is indicated at the symptom number against the medicine. This is for single-step elimination. For the cascading elimination, as soon as the medicine hits a 0, it is disqualified from further repertorization, thus eliminating it. Repertory graph technique. This is simple, more refined and scientific method. In this technique, repertorization is done on sheets when are skillfully and carefully devised to save the time and hard work and are specifically prepared for the repertory that is to be used. The chart having number of rows and columns. Medicines are printed on the first column and the symptoms are written on first row. The marks scored by the medicines are represented in the blocks at the intersection of the symptoms and the medicines. The simillimum is selected on the basis of repertory value. This technique is useful for the aggregation method of repertorization, because time consumption is very less. It is unnecessary to use this technique for the elimination method for obvious reasons. Demerits. Medicines represented in the sheets are less in number. Only polycrests are predominantly represented. Card system method. These are repertories which are in the form of prepared cards. Each card represents a symptom, cards are arranged together and the simillimum is found out. There is no need of writing down or bookmarkings, only the cards are shuffled together. This system is outdated on the arrival of computers. Computers. The utility of computers has extended to the various aspects of homeopathic treatment. The result of repertorization can be instantly projected on the screen, with the rubrics repertories D, the medicines indicated and their value in each symptom, also display the repertory value of medicines repertorized. The result can also printed as a hard copy on the printer. Advantages are limitless. The aggregation method can be conveniently used on the computer. Demerits. Doctor must have the necessary knowledge and aptitude to use the computer. Card system method. These are repertories which are in the form of prepared cards. Each card represents a symptom, cards are arranged together and the simillimum is found out. There is no need of writing down or bookmarkings, only the cards are shuffled together. This system is outdated on the arrival of computers. Computers. The utility of computers has extended to the various aspects of homeopathic treatment. The result of repertorization can be instantly projected on the screen, with the rubrics repertories D, the medicines indicated and their value in each symptom, also display the repertory value.